Hello, my name is Dr. Risa Levizo-Mori, and I'm the President and CEO of the Robert Wood Johnson Foundation. The foundation strives to transform our health system so that all Americans can live healthier lives and get the health care they need. Two groups of people we care deeply about are elders and the direct care workers who look after their needs. That's why the Foundation is working with NCB Capital Impact to support the Greenhouse Initiative. The Greenhouse model embodies profound culture change in nursing homes and long-term care, redefining how we support and respect elders and the people who care for them. I've always felt a calling to improve the lives of our elders, which is why, as a young physician, I chose to become a geriatrician. And as a geriatrician, it became evident to me that improving the work environment for staff was essential and a sure route to improving the quality of direct care services. Broadening the reach of the Greenhouse model is one way that the Robert Wood Johnson Foundation can express our gratitude and promote immediate and lasting change in long-term care. I hope that after you learn about this unique program, you will be inspired by the Greenhouse model to make meaningful, even transformative differences in the lives of the elders and direct care staff in your community.
It's much better here than it was over there. I can do more here for myself. I can walk around, I go in the kitchen, I go for breakfast, I go for lunch and supper. I just go right out of my room, right into my dining room. Easy to get around. I love my room. And I have more room now. I hang my clothes. I don't have to share that with no one. So I have everything here to myself. I feel safe here.
The goal is a complete transformation of the way we currently deliver skilled nursing care. So we want to move from an institutional setting, the setting that when you or I walk into it, we think, please don't ever let me have to live here, and how to transform that into something warm and to create a home that you or I would walk into and think, I'd be happy living here, or I would be happy to have somebody I really cared about living here, because it's like the home I would have myself.
I could see that conventional long-term care was a very broken world. So I got to thinking, what if I had a clean sheet of paper? What if I could just begin just with everything, every option open to me? And that line of thinking gradually became the Greenhouse.
The intention is to make it fit in the neighborhood, keep the scale as small as you can so that it doesn't start to appear like an institution. Make it have a warm feel. All of a sudden, where there had been only very traditional thinking, here was something radically different and something that I thought, firstly, would fit well with our mission, and then secondly, free those elders who need that level of care to be safe and sound and as healthy as possible. It really struck a chord with what it is I wanted to do and what I hoped for as we move forward with long-term care at Tabitha. And it also told me that there was something deep inside of me that maybe I hadn't even admitted to myself, that realized that institutionalization of elders was just not good enough.
I never thought I would end up in a nursing home. You know, this isn't really a nursing home, but it is. But when I was younger, why, that was the furthest from my mind, you know. And I was getting along good until I had back surgery. And then that kind of brings you up to date that you may have to be staying here. Really feel that I'm in the best situation that I can be in right now, so I'm very thankful for it.
Here's the problem with conventional long-term care. Conventional long-term care makes the doctors and nurses the star